Are back on Morning Line. Thanks for joining us. Our guest with us this morning is Dr. Gill Wright. He's the Chief Medical Director of Metro Health Department. It's good to have him on. And Metro, that's Metro Nashville here in Davidson County. But with his background of knowledge, what you're hearing from him applies just about wherever you happen to be watching this morning. So you're welcome to call in with a question or so. And actually, James waited through the break, Doctor. So let's take him as we continue our conversation about vaccines, flu, cold, and all that coming around this time of year. Good morning, James. Hi, James.
Good morning, guys. How are you this morning?
Good. What's on your mind?
Mine is, I've actually got two. They're kind of funny. We are going to be able to take the booster and the flu shot in the same needle, or are we going to get punched twice? And I wrote up on a lady that told me, she said, yeah, I took the flu shot, but then I got the COVID. I said, well, did you take the booster? And she goes, well, yeah, I took the COVID booster, but then I got the flu. I said, well, man, you might ought to stay in the house and not even got involved.
Good questions, my friend. And we're going to get to that, and that's good. All right, so we can also talk about COVID, and there is a booster now available for folks. And there's some folks who we maybe didn't even get the first booster, so you can get your next one now if you're ready for it. Can you get the booster at the same time you get the flu shot, and is it mixed together, or are there two separate shots?
They are two separate shots.
Okay.
You can get them together. There's a little bit more likelihood of having a little more severe side effects just because you're combining them. If you do decide you're going to get them separate, they have to be separated by at least 2 weeks. So, just because your immune system's
I guess
revved up for one.
Yeah, you know, I'm trying to think, because that's what I did. I put it off when I went, I think I went to Walgreens and got my booster, and that was probably about 2 weeks ago from yesterday, but it was close to that. I didn't know you had to wait 2 weeks between the two.
It's ideal to wait a couple weeks.
Okay, but that is why I waited. I thought, I don't want to get two slammed at the same time. As far as the COVID booster out there, and again, we know there are people that are hesitant to take it. Many people, have you noticed, Doctor, they got maybe the first two original vaccines, okay, that you needed. But so many people, and we've seen stories, have not sought out the boosters. And they're kind of like, you know, I went and got those first two, and I'm doing well, and I just don't typically like taking shots. Talk about the importance, or if you choose not to, and you did have the original first two, but haven't gotten any since.
Right. So, if you've gotten the original first two, so you've gotten your what we called fully vaccinated at that point, you do have some protection, but it does appear that it wanes or drops off over time. So the booster is beneficial in that regard. The original booster was a booster that was set up on the original strain of the virus. The new one has both, it's 50-50, the original and 50% of the Omicron, so which is the new, and it is thought that it will help us as the virus continues to change over time, provide continued good immunity.
Do you think you still get some protection if you just have from the original two? I guess not as much for Omicron, but maybe Delta or something like that. Are those folks still getting it, or after a period of time, it's just like we need new flu shots, doesn't that immunity wane to a degree? So
it does wane. It drops off some over a period of time. We don't know, because it's a new vaccine, it's a new virus, as to how long that is before it drops off to where it's no different than if you didn't have the vaccine at all. But it still appears that having the vaccine is better than not having the vaccine, whether you just got two or you've gotten the boosters along the way.
And just like the flu, as you said before, getting the vaccine with, you know, COVID or the flu virus doesn't mean you won't necessarily get it. There's still a chance you could, and yet the point being, hopefully if you do, the symptoms will be far, far less, and you won't die from it.
Right.
Okay, is that correct?
That is correct.
It's not gonna, and let me ask you this, because especially when it came to COVID, which unfortunately it became politicized, but there are so many people out there. I actually had someone tell me, well, you just don't know what this vaccine's gonna do 15, 20 years from now, so I don't think I'm going to get it. And I'm looking at him, I go, well, I can tell you what COVID's going to do to you right now if you get it. It's going to be a heck of a lot worse. But there's people like, well, I'm not getting it because, you know, we just don't know what that vaccine, maybe, you know, 15 years from now, my head's going to fall off. And I don't know, as you say, there's a lot we don't know about COVID, but when it comes to vaccines, there's people fearing, well, I don't want to do this. They rushed it to get it made, which is crap. But beyond that, I mean, there's people still afraid to get the vaccine for COVID.
Right. And, I understand everybody gets to make their own choice on whether they do or don't take the vaccine. But the technique of development for this particular vaccine has been around for 20 plus years. It's been used in other things, and it's found to be completely safe. So no reason to think that this vaccine is going to cause any long-term problems. But, everybody has their own,
Sure. Let me ask you this. To this point, we've been given vaccines now for, 2 years? I mean, starting with the first one. I mean, how many have there been? There have been how many boosters since the original 2 shots? It's 3 or 4?
You could have 2 and then this new
so
one.
I think
up to 3.
I've had all 5 shots.
Yes.
I've had all 5. So let me ask you this. To your knowledge, and you know it intimately, at least here in Davidson County, how many people have gotten sick from the vaccine and died?
From the vaccine and died? Not any that I know of.
0.
Yeah.
0. Okay. How many people have gotten COVID who weren't vaccinated and died?
Well, even if they happen to be vaccinated, there are a few that got very sick.
Even with vaccine
and
that
potentially died.
Were maybe compromised, but they're not. We're talking hundreds.
Right. If we're
Absolutely,
talking
thousands.
over 1,000.
Yeah. Okay, that have. So my point is people who are afraid of the vaccine, no one's being hospitalized for the vaccine, okay? And if you've read otherwise, it's a lie. And so it's basically, we know that the illness of COVID is putting people in the hospital.
Right.
So, well, let's go to Wilma. Wilma, good morning. Hello, Wilma.
Yes, sir.
What's on your mind? What can we help you with?
If someone has had COVID 3 times and survived it, are they immune to it?
Okay, great question. When you get COVID and recover, you get antibodies, right?
Right.
Okay.
And it does provide a period of time for about 6 months when you are considered to be immune. But after that, it drops off, and it drops off more than if you're vaccinated. So vaccine gives you a better immunity than having had it. And she happens to be very lucky if she's had it 3 times and recovered and not gotten hospitalized and put on a ventilator.
Is it if you do have it, okay?
Yes.
And you recover, how long should you wait before you go? You say, hey, look, I had it. I want to get the vaccine. I have several people who actually, for whatever reason, hadn't gotten their booster yet, got it, and they didn't die, but they were knocked out. And they said, I never want to go through that again. I'm getting the vaccine now.
Right.
How long do you wait till after you recover from COVID to go get a vaccine?
Well, they say you can get it immediately after recovered. However, you could wait up to 90 days, the time frame when we feel like you're pretty well protected.
Okay.
So sometime in that, most people I would recommend at about a month, just because then they're going to be fully recovered. It may give them a little bit of, it may activate their immune system and give them a little bit of some aches and stuff, just like any other vaccine might, and they might feel a little bit down for a couple days, 1 to 2 days.
Yeah. Wilma, if you've had it 3 times and obviously your body's bounced back, why not go get that vaccine, because maybe it'll prevent you from getting it next time, or if you do get it again, hopefully the symptoms will be far less than what she dealt with. And so she should be fine with that. But you're right, she's lucky having done it 3 times and recovered. Let's go to Ed. Ed, good morning. Hi, Ed.
Good morning, Nick.
Hey, Ed.
Good morning, Doctor.
Good morning.
Good to hear from you, Ed. What's up, my friend?
It's same here. Well, I'm still getting up and watching you. What I'm going to say is a lot of people says, oh, I get that flu shot, you're going to get sick and all this other stuff. Let me explain something to everybody. It used to be it was a live virus.
Yep.
And believe you me, it could put you down. The reason I know is because in the Marine Corps, when I was stationed in Japan, my first experience with the old flu shots, they only give half the unit the flu shot because they knew the other half would be cleaning up after those people. And then when the next week they come back, then the people that we cleaned up after had to clean up after us. So it was a deadly game. But now they've got a dead virus in there, and you're not going to get sick like a lot of people says that you will. And So anyway, but I got a question now. Not too long ago, I wound up in the hospital down here in Murray County in the emergency room, and they decided to keep me for a few days. But they said that I had C19.
C19.
No symptoms whatsoever.
COVID-19.
And then on top of that, I came home, and of all things, I gave it to my wife. I didn't know. You know, we wore masks, and then we started wearing masks here in the house for a while. Because most of the time I'm here, I don't get out that much. I'm 81, I don't get out that much. So anyway, you have to be careful about that. And I think what happened to me was I had the first booster, and I think that's what saved me. And then, but the wife had only had the first 2 shots, and I think that's what got to her. Now, doctor, if I'm wrong about this, please let me know. But other than that. But anyway, I'm live and kicking.
Okay, hang on, Ed. Let me answer that. I mean, there are people that are out there that are asymptomatic. He came home, didn't know he had it, and gave it.
Right.
How is that rare? How often does that happen?
Well, we see it. Younger people, especially kids, tend to have very little symptoms. And we always worry about, especially before we had the vaccine, we always worried that children would get it, take it to their grandparents and family members and share, like they do with all the other bugs and stuff they get. But in this case, he's probably right. He had a booster. His symptoms were minimal. She had not had a booster yet, so she happened to have not the same immunity level and maybe got a little sicker because of it. But even if she'd had the booster, some people just get it and get a little more severe symptoms than others.
And I wanted to ask you about that. There is such a broad range. There's from one end where you can be asymptomatic and get better and not even really know you had it and maybe get on with your life. And I see studies coming out every day with the long haulers, which is scary. Others that they're showing, with time. I mean, it definitely has on some people a real effect, even years later before it clears up on their cognitive thinking.
Right.
And then are there people out there too that maybe genetically one way or the other can be exposed to COVID and are just immune to it? I don't know who those people are, but could there be people walking around that just are immune to it and doesn't hit them for some reason?
Yeah, I don't know that we haven't proven that there's those that are just immune naturally. But, there's a lot of things that go into it. It's what are your underlying medical problems? How well are they controlled? How healthy are you? What do you do routinely? And then there's probably some genetics that plays in there. So it's
unknown, but it's true with all illness, like what you just said. If you're healthier, maybe you take care of yourself. If maybe you have lucky genetics, maybe not so lucky.
Yeah.
It makes you, because it's just such a broad range.
Yes, and it's the same with the flu. It's a very broad range. Some people 2-3 days and they're feeling better. Some people it's a couple weeks that they're really down and out. Potentially in the hospital even. So it really depends.
Take a break. Be back with more of your calls, more of our conversation with Dr. Gill Wright, Chief Medical Director of Metro Health here in Davidson County, right after this.